Hello, I'm Yoo-jung Yang. Today, I'm going to talk about the direction of nursing change in the age of infectious diseases. How did you all spend 2020? Was it depressing? My presentation is to briefly talk about what happened with COVID-19. Second, how will the medical environment change after post-COVID-19? And the end of my presentation is all about my 200 hours of quarantine service. COVID-19 first broke out on January 2020 in Korea, causing a lot of pain to the people all over the world. Due to the sudden outbreak, the work for medical workers flooded. Medical equipment and staff from infectious disease, specialized medical institutions were insufficient. So, how does the healthcare environment change after post-COVID-19? Experts predicted in the symposium at Seoul National University Hospital that the increase in the number of heavy patients with COVID-19 could increase the demand for non-face-to-face medical care for patients with mild cases. Untouched-based care systems include mobile vision, collecting biometric information through portable devices, and providing customized medical services by face-recognizable robots. Therefore, due to digitalization and smartness in the medical field, our nurses must be able to provide advanced care as a change agent in a nursing practice. As a nursing student, I anticipated that we should do our part as this is what we studied for. So I volunteered for 200 hours of COVID-19 quarantine at Jeonju Middle School during the summer vacation 2020. For all students in middle school, we asked them if they had self-diagnosed themselves, conducting fever checks, distanced themselves with one another, and trained them to wear masks properly. We also conducted activities about proper hand hygiene. After that, we cleaned the places that could be reached by students, such as classroom and handrails. There are two things that I felt the most important during this quarantine service. First, the importance of online self-diagnosis. When COVID-19 was spread in the community, I felt that it was the most important things for us to find the infected person and quarantine them as soon as possible. Second, to have a sense of ownership that I'm the owner. I thought it is important that individuals should live with responsibility because the people are the main agent of the quarantine strategy to slow down the spread of infectious diseases. Also, I realized that we need to find ways on working and communicating while learning in this environment where even the norms are shifting. Finally, through this COVID-19 volunteer work, I realized what kind of nurse I should be. I thought I should be a nurse who can prepare for blended medical services combined with patient-to-person counseling and online services, as various forms of nursing service would increase as we enter into an untapped society. I also felt that I needed to be a nurse who could develop and provide patient-centered, customized nursing education, counseling, and management programs. I have vowed to become a nurse with insight and technology that fits the undetected society, and a nurse who knows that she is truly happy when dedicating herself to others, and informed us that we should all be such nurses. Lastly, I hope everyone can overcome the situation by cheering up and caring for each other. This is the end of my presentation. Thank you for your attention.